Hello, everyone, and welcome to our monthly community podcast. My name is Ana Isadame, Health Promotion Specialist, and it is Public Health Week. So today we have Health Director Kevin Grieme with us joining. Thank you for talking to us today.
Thank you, Anais, for the opportunity. Appreciate it.
This is your first time on our podcast.
First time podcast, so we'll see how it goes.
Would you like to tell us a little bit more about yourself and how long you've been at the health department?
Oh, sure. I've been at the health department for almost 20 years, and the last 10 years I've been serving in the role of the health director. So it's just been an interesting evolution over that period of time of all the changes, improvements, and the great new things that are coming out of Siouxland District Health Department these days.
Mm-hmm. Awesome, thank you. You weren't always the director, right? You started out in
No, prior to my
positions.
original start here was with emergency response planning,
Mm-hmm.
and I was hired into a position where I worked across 16 counties and assisted their local public health agencies in developing their emergency response plans.
Right.
Then I had the opportunity to move into doing the it was the grant coordinator, which then that really gave me a great knowledge and awareness of all the different programs that Siouxland District Health offers. So when the opportunity came for the director, I thought, well, who knows, might as well throw my hat in the ring and see what happens. So here we are 10 years later, and they've still kept me.
Yeah, well, we love having you as our director.
Thank you.
So like I mentioned, it is National Public Health Week. Can you tell us a little bit more about what public health is?
Public health is really what I look at is we're trying to make the healthier community for people to grow and live in. And we want to make sure that health is accessible to all. One of the things is, we look at our life expectancy as one of the measurements of that.
Mm-hmm.
And this is one of the first ones where they're saying the generation after us may not outlive. It lives shorter periods of lives is what it was because of conditions that actually exist. But we look at all the advancements, and what we really want to see is the community set up to be as healthy as they can as possible.
Can you tell us a little bit about why public health is important as well?
I think the role we really look at is we talk about looking at the prevention side of it.
Uh-huh.
Really, when we moved into that full medical model, it's the intervention. And so like public health, we don't have physicians in our offices that do
Right.
this. We're looking at getting ahead of the game. We want to prevent the incidence and the impact of disease on our residents and each other. And so I think when we take a look at doing that for prevention, for example, is I look at the work in the community over the past few years on when we took at the walkability indexes, our trail system for biking, running, etc. Those are all phenomenal amenities or things that we've added to the community, not us as Siouxland District Health Department, but through our community partners. And that's really a part of what public health does, is that linkages, the partnership, the collaboration. We want to set and be a part of the discussion to give guidance from a public health perspective, but really to work with our partners in supporting them in implementing some of the things and those strategies that improve us. We've also taken a look at, our public is changing. For such a long time, when we looked at recruiting individuals into the state of Iowa, they only looked at our education system and work ethic. Now we're sensing that there are more and more people really looking at that, what we call the quality of life or other standards within the community. So we think public health fits that well. What's out there for options for healthy foods, the physical activity, what do we set up for with the environment, the work on HU2 and tobacco prevention is very important also. That was a milestone legislation that occurred a number of years ago, but they're still part of the battle, the education and the things we need to do. So that is really all that public health does. But then what gets a little confusing, we don't have physicians, but we do the direct services. So when we look at, for example, our Women's Infant and Children program, our goal with that is assisting those young families and those children to be more nutritionally competent and fit. So we're looking at what they're eating. I always look at the case, we had one grandmother that was helping to bring the grandchild into the WIC appointment. And in the conversation with one of our dietitians, she asked, well, the child was a little overweight, and the grandma says, well, what we can do. So they started talking about their lifestyle. So what sort of snacks do you have? How frequently does the child eat, and that sort of stuff. And then they talked about options. Well, a few months later, they noticed that there had been basically the child had grown up some, but had also reduced in weight. And they asked, what had they done? Well, from that discussion, the grandma no longer kept all some of those soft, just calorie-rich sort of foods. She kept more fruits and vegetables, more healthier alternatives. They structured their day as far as when they sat down and ate and that type of stuff. And that was another key thing, is the child didn't walk around the house just eating food. They sat down and had a scheduled time. And that's where they started seeing the marked differences. But you look at that continuing forward, if that child continues in those behaviors, it overall is going to have a positive impact on them. much as we look at with the immunizations and the incidence of disease. We know there are vaccine preventable diseases. We need to get as many people protected in that fashion because, as we learned in COVID, once the disease gets a toehold and we have an unprotected audience, it's only going to grow. Then it has impacts on each of us as individuals, our mental health, our economic stability, working, school. We just look at that, and those are things we say, we can't allow that to happen.
Right. So public health involves a wide range of topics, lots of prevention, like
Right.
you mentioned, and education as well. How do we, as a public health entity, base our practices on?
We really want to take a look back, and we want to base the decisions and the practices we do on science. We all agree that science is a priority for everyone to be aware of and to learn, but I think within the science what we have to understand is what is that impact in the science-based approach to some of the different preventative strategies. We know over the course of time for research is we look at the whole aspect of people have said, well, how is literacy, early childhood literacy linked to public health? Well, what we do know is the fact that those individuals whose educational attainment is greater have a greater potential for living a healthy lifestyle. Therefore, it's very important when you get back to the root cause of it is we need to assure, one, that 0 to 3 is getting adequate stimulation for the brain growth and development, and then we need to move them in the next levels, their literacy ability, because that indicates not only their comfort but success in school, their ability to learn, and then potentially looking at advanced education. Those are all positive factors, not only economically, but health-wise. So those are why we support some of those initiatives. When we look at the tobacco, we look at the incidence of the tobacco is caused in cancer or other conditions. So we base the science, we're looking, where did that come from? Well, through science, they originally were targeting those individuals directly using tobacco.
Right.
The next level, they started doing the research because we saw the incidence of certain cancers in those in living in secondhand smoke. So they thought, okay, we need to get not only the users, which will increase those exposed to secondhand smoke, that's going to be some of the strategies we have to reduce the incidence of cancer caused by tobacco. So those are all the science, the research, that's the information we base many of our and most of our practices and decisions upon.
Thank you for providing all of that great information. I don't think, many people realize that a lot of, what we do comes off of basically what we know, the data, the science behind it, all of that. So can you tell us a little bit more about Public Health Week, what it is and why it's important?
Yes, Public Health Week comes up on April 3rd, the beginning of it, and what we're really looking at, that's a chance to celebrate and acknowledge the work and the protective factors that public health has. That's both on a national, state, and also on a local level. There's many campaigns and issues out there, but really what we look at as a local public health agency is the number one focus is internally as an organization to celebrate the work that we have all collectively done. There are a lot of national days of observation for nursing, dietitians, nutrition. You keep going. But we culminate all that into National Public Health Week because we celebrate all of those professions. They play a role and they have an impact, so we look at that. So there's staff that are putting together some things internally with there's some quizzes that'll come up, there's kind of a reception sort of food fun thing that we'll be doing. I mean, there's just a wide variety of different stuff that we just want to let staff know.
Mm-hmm.
The job that you do is important, the work is valid, and the input, your energy is making an impact. And that's what we want to make sure that they're aware of doing, along with sharing outside the community, or outside of our building, just the work that we do. And we think that's important too.
Yeah, definitely. Do you have any tips or suggestions for anyone wanting to get into public health?
Oh, I would say you need to go out if you look at shadowing someone would be one thing to take a look at. Just pay attention. There's, information on the web. We do have colleges of public health that are in the state also is what it would be. I mean, those are our valid places. Even in the aspect of when you go into some of our local health programs, nursing programs that are right here in Sioux City, they all have a community base in faction because they understand the impact of it means to be in and with the community in doing some of the work. And so any of those ventures and items, this summer we're looking at doing something that'd be a great opportunity if young people are interested in learning. We're doing what we call an SDHD fair. and we're going to plan that here at the building. It's coming up in this July. Pay attention to future announcements. But that's a way to come in and to hear not only about the programs we do, but you're going to get to meet the staff that do those programs and ask them questions. That's the number one key. Ask the questions, find out the information you want. There just may be a piece of it, because I will tell you, when I came to Siouxland District Health Department, it was because of sort of a forced transition in the job market. And so I was just looking, I knew I wanted to stay in the community, I had a young family, and what I ended up doing is somebody got a hold of me, and one of my people in the network said, hey, Siouxland District Health Department has a couple positions. I did not know what public health was at that point in time, and so I studied up, applied, got selected for one of the positions, and that's where the story began. So prior to that, I just knew it was a place that, in fact, it was interesting. I found in some of the records, the record of when I brought my infant daughter and myself, we both had to get shots. Her for her infant scheduled one, me for going on to grad school. And I thought, oh, I'd already been touched by public health, but did not know that's how we were touched. So yes, any way you find out about it, if you fall into it or whatever it is, we welcome the question and the opportunity to work with you.
If someone wants to get a hold of you to either talk about more about public health, or if they have any other additional questions, do they just call the health department?
Call the health department and ask for Kevin, and they'll pass you through, or go to our website, siouxlanddistricthealth.org. I'm in there in the contacts also.
Yep. And then our phone number is 712-279-6119. If you have any additional questions or concerns, feel free to reach out to us either by phone or email, social media as well. Thank you again, Kevin.
Thank you, Anais.